We have from the Maui Memorial Medical Center Emergency Department. She's the manager there. Want to say good morning to Jessica Rozet. Good morning, Jessica.
Good morning.
You know, the emergency department can be a tough place to work, as you know. And as the nurse manager there, what types of violence and aggression do you see specifically in the ER?
Yeah, so the ER can be a very stressful place for patients and their families. Most commonly, we see aggression when there are, of course, long wait times. Patients become frustrated and they get really agitated when they have to wait longer than they expect for treatment. Also, when people are in extreme pain or discomfort, they tend to lash out. So here we get it. We're all human. We're not invincible. We also see many patients who are not in the best headspace. So whether it be mental health issues, under the influence of substances, they tend to lash out. Many times, misunderstandings or lack of clear communication between staff and patients can escalate tensions, especially when the patient or family member is in distress. And the bottom line is that we, as the ER staff, we don't want anybody in the hospital to get hurt, especially in the ER. So we know that it's our job to be patient, understanding, and try to be calm and communicate as clearly as we can.
Being patient with the patients. Yeah, Jessica.
Yeah,
awesome.
yeah.
I know you guys do a great job there. Aloha goes a long way, which I know you guys use as a tool there.
Yeah.
Jessica, what are some simple, everyday actions that both healthcare workers and patients can take to help create a safer, more respectful hospital environment?
Yeah, that's a great question. It's really about everybody doing their part, not just patients and not just hospital staff, but everybody. Sometimes it's hard, especially when you've had a tough day or in a tough spot with your health. So just a few things to try to do and remember. One, of course, kindness goes a long way. So putting yourself in the other person's shoes really helps everybody see situations with a little bit more empathy instead of frustration. For us as staff, thinking how would I feel if my child was suffering, or how would I feel if my family member was in that bed? Yeah. And then for the patient, thinking, wow, it's really busy in the ER. The staff must be really tired, but they're still doing their best.
Yeah, taking a lot into consideration. And at the end of the day, we remember that we all live on the same island. Yeah, Jessica?
Yes. Yeah, everybody's connected. Everybody knows everybody.
Right.
So.
And, as we wrap up Workplace Violence Prevention Awareness Month, what's the biggest takeaway you hope the community remembers?
The biggest hope I have is that everybody realizes that workplace violence is really real and it's really prevalent in the healthcare area, way more than people think. Healthcare workers are 5 times more likely to get yelled at, physically threatened, or actually physically harmed here in the ER, and actually throughout the whole entire hospital. So, stress affects everybody, our staff, our patients, our family. And the people here are not just people in scrubs. We're neighbors, we're friends, we're family members. So we have a pledge on our website, mauihealth.org/pledge. So hoping that everybody that's listening can take the pledge to support our friends and family in healthcare. Just be aware of workplace violence.
Yes, for sure. Well, Jessica, a lot to consider there in the ER, but we have hope, We have hope for our workplace, our healthcare workers, and for our patients here on Maui. Jessica, thank you for calling us this morning.
Thank you so much.
Have a great day.
Thank you.
Aloha.
Aloha.